Hey girl, hey. This is Dr. Tasha, and I am back with another episode of Dr. Tasha After Dark. Okay, so I feel so compelled to have this conversation because I just be wanting to about this damn shot. Okay. I have people at the extremes of this shot. So we have people who are like, I want to do it myself. I don't want to rely on the medicine. You got that. And then you got people who are like, give me the shot. You got that. And then you have the people in the middle who I like, who are like, okay, let's talk a little bit about this. Okay. I want to talk. I think that the shot has gotten so bastardized. And from somebody who did a bunch of studies in obesity medicine, who trained in obesity medicine, I get so angry, but I can't get angry with you guys because you only know what you're told. If you're not told a lot, then you're going to go to social media, and then the worst part is we have the doctors, a lot of the primary care doctors just giving it out, don't know what they're talking about, don't know what they're doing, and they're leading you guys down a dark and not good road. Y'all are going to have the phentermine effect. Y'all know what that means. You lost 30, you gained 45. That's what's going to happen to you if you don't do this the right way. So let's talk about the shot, myths about the shot, lies, child, lies. And then I'm gonna tell y'all why y'all look so damn old. Y'all look like y'all died 3 months ago. I mean, y'all walking around looking like the damn crypt keeper. And some people like, damn, she look a mess. She look better fat. Yeah. So let's talk about that. First of all, when we talk about the shot, there are 4 shots. Okay. You have Ozempic, which I don't know why people don't love. Let me break this down for you. I hope y'all got a pen. Okay. Let me give you a second to get a pen because you need a pen. Okay. So Ozempic, which, okay, is for diabetes. Okay. Then you have Wegovy, which is for weight loss as well as cardiovascular issues. Like if you got hypertension, stroke, blood vessel, like all that kind of stuff that we're trying to improve any cardiovascular issue, Wegovy is what's indicated outside of weight loss. Those 2 medications are semaglutide. Both of them are semaglutide. They're essentially the same drug, semaglutide. They're the same medication. One they have indicated for diabetes. The other one is just for obesity and cardiovascular stuff. Got it? Now you have 2 other medications. You have tirzepatide, totally separate drugs. Tirzepatide is stronger and has been found to work a little bit better in a lot of studies. But one type of tirzepatide is Zepbound. Okay. Zepbound, it is indicated for obesity as well as obstructive sleep apnea. So if you at night, you got obstructive sleep apnea. If you snore, you got obstructive sleep apnea. Okay. So even if you may not be obese or just a little bit obese, it is indicated for obesity as well as obstructive sleep apnea. You got it? If your insurance company won't pay it for obesity and you have obstructive sleep apnea, tell your doctor, hey, I have obstructive sleep apnea. Can I get the Zepbound? There's like an obstructive sleep apnea question scale that you can do. You score on that scale and it'll let you know whether you have obstructive sleep apnea. Usually when I do prior authorizations, I go ahead on and I go ahead on and I make sure that I code for obstructive sleep apnea if that's what they have, and then I put the score. And it usually gets approved. Even if they don't approve it for obesity, they will usually approve it for obstructive sleep apnea. But you got to really have obstructive sleep apnea. You can't just be walking around saying you got it, you ain't got it. So your doctor has to take some strides to actually have you do the questionnaire, score the questionnaire, and then send that in with the prior authorization. Okay. And then you have Manjaro. Manjaro is the big boy. Manjaro is the strongest of them all. Manjaro is indicated for obesity, but it's really indicated, like Ozempic, is indicated for diabetes. So a lot of times they'll say, what's her A1C, which lets them know whether you're diabetic or not. Or if you have a long-standing history of diabetes, Manjaro is the medication that you would be prescribed, right? So you have semaglutide and you have 2 different types. You have tirzepatide and you have 2 different types. I'm just letting you know right now, you have all these different pharmacies. And I'm going to give you the dangers of that. So you have the regular pharmacies, obviously, your Costco's, your Walgreens, your CVS, your Publix, all these pharmacies. that are real pharmacies that the drug comes from the company. And then you have these compounding pharmacies where people just making stuff up, got you drawing stuff up, you getting stuff from the mail. It might seem like the thing to do, but it be killing me because y'all same people who are conspiracy theorists and wouldn't take the COVID vaccine, y'all gonna inject whatever the hell these people tell you is in that shot from some company that just mails you some stuff and you don't know who the hell they are or what the hell they putting in it. So people say, "Oh, it's compounded with what?" You can't just what is it compounded with? And are they just giving you a whole bunch of a vitamin complex and they saying, "Oh, it's the weight loss drug." Mm-mm. So that's not altogether safe for me. Let me tell you, I have a patient, I'm sure she's watching. Hey girl, hey. She called, she was like, "Doc, you weren't in the office, you were away speaking, and I had a UTI. I know I had a UTI. Something was going on, blah, 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 blah." So I got online and I found this medical thing. And I'm like, "You got insurance. Why you ain't just go to urgent care?" She's like, "I don't know." Right. I got online, I found this medical thing. I told them the symptoms. I knew what you had gave me before, so I told them this is what I wanted. A day went by, they mailed it to me. After I took it, things got a little bit worse. Stuff starts smelling crazy. My urine starts smelling crazy. So I saw her in the office. Child, that thing had just as much UTI. And where I said, "Well, what in the bejesus?" So I said, "I don't know what they sent you, but it sure wasn't no damn antibiotic, cause girl." So be careful with what you guys are willing to put in your body for weight loss. Okay. Now, I want to say this. Okay. And this is to doctors too. Yeah, I be coming at y'all sideways because I need to. Any person who will give you a weight loss injection but won't give you a full plan to follow is somebody who should not be prescribing weight loss medication. You're out of your league. You don't know what you're doing. Either take the time to read and learn or don't prescribe the at all. Okay? What does that mean? So, in my practice, I don't really like to call it weight loss because I'm not manipulating your weight. I'm manipulating your metabolism. When I manipulate your metabolism, your lifestyle plays into that manipulation and then your weight follows, even if you're on the medication. In my practice, I might put you on more than one medication. And at the end of the day, if you do not follow the plan, I do not see you and I will not refill your injection. You got it? Why is that? Here's why this happens. These medications are called GLP-1s. GLP-1. So what this is GLP-1 is a protein that is in your body that basically says, "Hey, I'm full. I'm full." That's what it says. So what these shots do is they upregulate your GLP-1. So they make you feel full faster and longer. That's all they do. They don't burn fat. They don't do any of that stuff. They make you feel full faster and longer. So then what happens? And people think weight loss is all kinds of complicated and we'll play into metabolism and all that. But what ends up happening is, let me tell you what weight loss is in general. If you burn more than you eat, you lose weight. If you eat more than you burn, you gain weight. So for all of y'all who are like, "I don't even eat that much," and you 325, you have to maintain that 325. So I don't know what you eating, but you eat enough of it to maintain that 325. Now, barring medical problems are aside, okay, whatever you got going on outside of just regular old weight gain, that is the formula. Now, the one thing that I will tell you is that we all are overweight for different reasons, right? Based on your A1C, like whether you are pre-diabetic or not, or diabetic, based on your BMI, that lets me know whether you're insulin resistant or not. So this is why you need a consultation with somebody who knows what they're doing. Because when I'm looking at your numbers, I'm looking at your cholesterol, I'm looking at your A1C, and I'm looking at your BMI, that lets me know whether we're diabetic, pre-diabetic, insulin resistant, whether we got hypercholesterolemia, what meds do you actually need to be on? Because see, obesity is a disease, which means it requires treatment. I know when you were 25 that what you would do is get in the gym and do 10 squats and you be down 15 pounds. You ain't 25 no more. Okay. You ain't 25 no more. And for all you trainers out there, I know you feel like you're training a person's body. And for very few individuals, you might be. But what you're training is their metabolism. And so there are some people who are going to lose weight in different ways based on their metabolism. Because some people, especially our insulin resistant people, when they weight gain heavy weights, they gain weight. They gain weight. So I'm not a big fan of group training unless it's like high impact interval training, cardio training, resistance training, because everybody loses weight in a different way and they have to lose weight in a different way, but you're training everybody the same. Another reason I'm not a big fan of group training, and say what you want, drop it in the comments. You're free to have opinions. I'm just telling you the medicine. The deal is this: for every 1 pound you carry, and trainers, maybe you might want to hear this so that you can have a different level of respect for your obese patients. For every 1 pound you carry, your niece carries 4 pounds. So when you have somebody in your class that is 300 pounds, her knee, one knee, is carrying 1,200 pounds. The other knee is carrying another 1,200 pounds. Her hips is carrying 2,400 pounds. How much does a car weigh? About a ton, which is about 2,000 pounds. So this person is carrying a little bit more than a car. So don't treat her with the level of disrespect. Don't treat her to feel that she should be able to do the same thing that the girl in a class that's 130 pounds can do. You see? So at the end of the day, group training, I don't know. It depends. If you're middle of the road, if y'all are not doing heavy weights, it's so much. If you got joint issues, you should really be in the water versus putting more weight and stress on your joints. So it's so many things that come along with a treatment plan. You see what I mean? You see how different this is than calling somebody up and getting a shot sent to the pharmacy for you, or registering some stuff online and having some stuff delivered to you. You see how deep it gets? Right. Now, another thing that I'm focused on is the diet. And it's not a diet, I call it a food plan. Why? Because if you need to lose weight, it is protein. It's protein. So, proteins and vegetables is what we focus on. Little to no sugar, little to no carbs, no processed food, no alcohol for a time. This is while you're in treatment. Once we've kind of gotten to our goals, our metabolism is normal. We're not overproducing insulin. Our hemoglobin A1C is no longer pre diabetic. Our joints are out of trouble. Then we move people to the maintenance phase and the plan changes again. Some people actually require another medication that I will add on, and I wean off of one and I'm really consistent with the other. You see how in depth this is? Let me tell you now. So people say, I don't want to cheat. How are you cheating? Because if you actually are going to a provider who knows what they're doing, even if you're getting the shot, baby, you still have to change your life. You still have to change your diet. You still have to change your lifestyle. You still have to move. Because let me tell you what, if you don't, you're going to have the phentermine effect. That means I'm going to lose all this weight and then I'm going to gain it all back and then some. And then it's going to be harder to lose. Why? Why is that? It's the same reason that people are on the shot and they look like the damn crypt keeper. Because what you did was you starved your body. You starved your body. You said, I ain't hungry. I'm trying to lose weight. I ain't going to eat. That's not how that works. That's not how that works. That's not how that's supposed to work. If you're in a space where you're not eating at all, your dose is too high for whatever it is you're taking. You should be eating, but you should be trained, managed, and your diet modification should be things that your body can use, wants to use, and gets fuel from. Food is fuel. Food is not something to socialize over. Food is not something to save and be like, Girl, that thing was good. That is not what it is for. That is an emotional attachment. Food is fuel. If you don't put gas in your car, what's going to happen to that car? Okay. So a lot of people who are on the shot and it's not being done the right way, what do? They complain about fatigue. I'm so tired. I'm tired all the time. Maybe my iron is low. I'm so sick of people with this low damn iron. Everybody can't have low damn iron. My iron is low. No, you're malnourished. And that's why you start have muscle wasting in your face. Okay, the fat in your face is gone. You're malnourished. That's what that is. That's why y'all walk around. Look, I can always tell the people who are on a shot who are not being managed properly. Now, shout out to all of my patients because we don't play about that over at Atlanta Premiere. Y'all drop comments. Let these folk know. You can even put your pitch up if you want to. My patients do not look malnourished. Their faces are full. They do not, in my program, we probably lose about 100 pounds a year. They're probably anywhere between 9 and 13 pounds a month consistently. Yes, I fluctuate the plan. Yes, I do the yes, but it is their responsibility to make sure they're doing the work physically, that they are changing their diets and their lifestyle, that they're drinking 80 to 100 ounces of water a day. They are not having sugary beverages. They're not eating carbs. They're not eating fast food and processed food. They're not eating out. We're treating their inflammation. Oh, we don't play about it because it is not about a number on a scale. It is about your overall health. We are improving your health. It is not about a number on the scale. Does that make sense? I hope it makes sense because it should. So while all y'all walking around looking older and worse on the shot than you did before the shot because you misused the shot. And it's okay because you will be big again soon. So you will get that fullness to your face again. No worries. So and I'm being malicious. Excuse me, I'm being facetious, not malicious. I'm being facetious, but I'm being honest. And I'm not really attacking you guys because you only know what the doctor told you or didn't tell you. And or my insurance didn't cover it, so I got to get it the best way I know how. But what you didn't stop to remember, understand, or know is that even if you're on the shot, you still have to change your life. You still have to move your body. You still need physical activity. You still need to drink water. You still need to eat nutritious foods, minimal carbs, not processed foods. You still have to feed your body, if that makes any sense. I hope it does. I hope it makes a lot of sense for the people who feel like you're going to get on the shot and you're going to rely on the shot and you're going to eat one wing instead of 20 wings and you're going to lose the weight, but it's going to come back. You taught your body nothing. You taught your metabolism nothing. You did not strengthen your heart. You did not do any of the work that it was required for lasting health change. You didn't. You didn't. For my people who are on the other side, who are saying, I don't want no help from the shot. Well, that's rather ignorant because if you're going to remain overweight and suffer the consequences of obesity, what is wrong with help? It is not a crutch because see, you're thinking about the shot the same way these folks over here are thinking about the shot, and that's not how you need to think about the shot. So don't feel like the shot is doing all the work because that's problematic, right? And for the people over here, don't feel like the shot is doing all the work because that's problematic. But for my people who are right in the middle, who understand, I got to put the work in. This is going to help me meet my goal because I've been trying to meet my goal for so long and I've been unsuccessful. I didn't realize that I shouldn't be lifting a bunch of weights because that makes me gain weight because of my metabolism. I didn't realize that. I didn't realize that not having oatmeal was bad. I mean, not having oatmeal is good. It's too many carbs. The amount of carbs in oatmeal is about the more carbs than I need for a week. I didn't realize that. But because I didn't realize I had an insulin resistant metabolism, nobody ever told me I was pre diabetic. Nobody ever told me there was medication I can take. There's a treatment plan. Nobody ever told me that I can actually and should actually be treating my pre diabetes. So what we need to do is truly understand what we're doing here. And it kind of gets me sometimes because the technology has given us something to fight that is really kicking all of our behinds, and it's obesity. It is obesity. Obesity worsens your stroke, heart attack, all cancers, all autoimmune disorders, depression, like anxiety, like everything. Depression worsens everything, morbidity, mortality, recurrence of breast cancer, like everything. So it is such a blessing that we have something that can really help us, but we have to understand how to use it properly, not bastardize it, not abuse it, and not use it in a way that it will hurt us in return. Got it? So if you are in the space of looking to change your metabolism, we're not really accepting any new patients right now, except for metabolism management, because I feel like it is such a big deal and so many people don't do it, or they don't do it right at all. So please, if this is something that you're interested in, but do not even reach out to us if you're not going to do the work. Do not even waste your time or money, because yes, it is a paid visit. It is not something that is covered by insurance in my practice. So do not even reach out to us if you do not want to do the work, because I'm going to be on you. And I know when you're not telling the truth. I know when you haven't done something you're supposed to do, based on the things that I see, based on your symptoms, based on your measurements, based on your weight loss. I know exactly what you are not doing. So please don't even reach out to waste your money and my time. But outside of that, if you want to learn, if you want to understand, if you want to understand what your metabolism is doing, if you want to fix yourself in menopause because your metabolism likely has shifted. I don't know where this narrative came from. Or we need to weight train, we need to strength train in menopause because we need to strengthen the bones. What the hell? Strength training don't strengthen no damn bones. Calcium does. The bones? What? Huh? What? Like where? What? Who made that up? No. So understanding what your metabolism is doing and how you need to help and support your metabolism so that you can get healthier, remain healthy, or get healthy in the very beginning. So we're here for you, but I hope this sparks a little bit of question asking, some curiosity, some things maybe to ask your trainer, some things maybe to ask the person that you have. Um, Gotten medication from. Maybe if you've been denied medication, to say, hey, I have this condition. Can you now try and get me approved for the medication based on this condition? I just want you guys to be doing what's safest for you and what's best for you. Thin does not mean healthy. It means better on your joints, but it does not mean healthy. So we need to get healthy out here, not just thin. Okay. So hopefully this blessed somebody. Hopefully you heard something that you needed to hear. Hopefully you heard something that makes a lot of sense to you. And now you have your list of questions to move forward with, and also to know what not to do as well. So thank you so much for joining another episode of Dr. Tasha After Dark. Please subscribe. Okay, click like. You got to click the like so that these people understand that you love the vibes here and you want to keep seeing these videos. And don't be scared to hype it up. Don't hate. Don't be scared to hype it up. Okay. So again, until next time, and we see you back again. Thank you so much for joining Dr. Tasha After Dark.